Hello, my name is Jennifer White, and I am going to be giving an oral presentation over my research on the use of remdesivir for the treatment of COVID-19. So, as I said, my name's Jen. I am a registered nurse. I graduated in May of 2020, right in the middle of the pandemic. I took my first nursing job at a hospital who was on a designated COVID-19 floor. I was terrified, but I'm so glad I jumped in and was given this opportunity to learn so much. It was very high intense emotions for me, for the patients, for the doctors. It was a great experience, and I'm so grateful for it. I chose this topic because I encountered so many patients who were offered remdesivir as a part of their treatment, but when I would say what I was about to do with the medication and what it was, and they were just basically lost in the sauce. They never heard of it. They were terrified to begin with. When they were diagnosed with COVID-19, they instantly thought it was a death sentence. They've heard so many news stories and family members or somebody who knew somebody that as soon as they got it, they died. It was a lot. So I just feel like the public does not know much about remdesivir, which wasn't a very popular drug to begin with. So I don't know why people would know too much about it. So I'm here to shed some light on remdesivir. I did find some research studies that were done to show the efficacy of the medication against COVID-19. I found ones that were based on the patient's use of oxygen and how effective it was for that. And then I found one that was based on the days of treatment. So between a 5-day or a 10-day treatment, and compared the two. I'll discuss the outcomes of those research and also what we still don't know using this drug with against COVID-19. So let's get into it. So I want to talk about how remdesivir actually works. It is an antiviral medication. It interferes with the replication of only RNA-based viruses. So the medication was developed to combat the Ebola crisis. Ebola is also an RNA-dependent virus, and it shows great efficacy against that one. So they were like, let's try it for this novel virus because there was little to no treatment options for these patients with medicine, with antiviral medications when this pandemic hit. So researchers did some studies in the lab. It showed promise. Remdesivir showed it was effective slightly to the coronavirus in petri dishes. So they wanted to continue the research, and they did. They found that it was a reliable option. They didn't know much, so the FDA authorized on May 1st of 2020, they could use the remdesivir as an emergency use medication because it did show promise against it. So let's talk about the efficacy of remdesivir. So there was a research study based on oxygen use. They used different levels. So there was a low risk level, which meant they used little oxygen or but no oxygen. And then the medium level risk was people who were using a higher flow. We call it OptiFlow in the hospital. It's just a high flow nasal cannula that delivers intense high flow oxygen. And then the high risk was the category of people who were mechanically ventilated. So they gave remdesivir to each of these categories. It showed great promise against the the mechanically ventilated patients. It showed a decrease in death rates, as well as it showed they were actually taken off the ventilator sooner than if you weren't treated with it. So it showed great promise, and 30.5% they showed a decrease by day 28. So the next research study compared 5 days to a 10-day treatment. Each person in the study received a loading dose, was their first day treatment. I experienced this in the hospital. We always gave a higher dose on the first day, and then the consecutive days it was a lower dose, but then it was the same amount after that. So they compared the 5-day to the 10-day and found that the 5-day showed really good promise, and it was very effective compared to the 10-day. They showed that the 5-day, there was actually clinical improvement compared to the 10-day. So they didn't need to be put on mechanical ventilation if this medication was given for 5 days. It was obviously both of them still had people who passed away. It wasn't 100% mortality relief, but it did show promise. And it showed that you didn't need a longer course of the treatment for it to be effective. In my experience, I only did 5-day treatments, so I guess they were aware of this information and went with it. So I want to also talk about the delivery methods of remdesivir. There's 2 different ways right now. The most common way is intravenously. It's given in the hospital through an IV once a day. That's the only way I've ever given it. There's also the pulmonary aerosol delivery method, which is introducing the medication through an inhaler type that introduces it directly to the lungs. This was thought to be very effective because the medication was being delivered directly to the lungs, and it can metabolize the medication differently. This research showed that using them together, IV and through the pulmonary method, it did show great effectiveness towards the virus and better outcomes. So that is a very interesting way to learn that this medication can be delivered both ways. So the outcomes of the research was it did show good promise. Remdesivir was effective towards the coronavirus for many people. It wasn't 100%. There was still loss, and it's still not bulletproof, but there's an option, which is great hope for a lot of people. We still don't know if it can help against the long-term effects of COVID, and if it is truly the only drug that we should be researching right now. The only antiviral, maybe there's another one out there that it could show better promise. So there's much research that needs to be done still. Thank you so much for listening to my presentation. If you have any questions, please reach out to me. I'd love to help in any way that I can. Thank you.